Not in my usual environment because we have a house guest. So I just wanted to introduce this short clip from Dr. Monique VanRenterghem, who's an emergency room physician in Pennsylvania. All patients and all doctors at some point deal with diagnoses that were not expected, diagnoses that are serious, treatment decisions that are just difficult and stressful and were not expected. How do doctors and patients alike communicate about these difficult subjects? Monique gives some great suggestions. Number one, she calls in the chaplain. Number two, she prays with her patients and has no qualms about it, especially if they ask for it, and some do. And she also talks about listening to patients who have a lot going on in their lives and hugging them and just taking a moment to be with them and be present with them. All of this helps her as well as her patients. Here's what she has to say. What kinds of situations would prompt you to say, oh, I better get a chaplain here to talk to this person?
Well, actually, in the ER, there's a lot of situations. We see people, that are very, very sick that had to, be intubated and go on a ventilator, and just kind of navigating through that with a patient's family member would prompt me to say, hey, do you want to speak with the chaplain? Or, at my current institution, I say, here's the chaplain, and let's talk about the medical aspect. And I'll often stick around to talk about, how this impacts them spiritually and emotionally. Pray with patients if they would like to. Oftentimes, too, in the emergency room, we're giving bad news, like you came in for abdominal pain, and here on your scan, we found that you have metastatic cancer as a new diagnosis. Mm-hmm. So those are often situations where I'll ask for the chaplain to come so that they can be there when I deliver bad news, because I've done it kind of both ways, with and without a chaplain. Mm-hmm. And it's certainly always helpful to have somebody else there, especially if the patient doesn't have a family member.
Mm-hmm. And a lot of times when I was in a hospital, the doctors would ask almost with hesitancy, can I pray with someone? Can I do that? Mm-hmm. Have you done that yourself?
Absolutely. Yeah.
Okay.
And I think, actually, I've had people ask for me to pray with them. I've offered to. I think it's fine either way. Mm-hmm. And I don't even think you have to be part of their religion to understand how, just being there spiritually with them can impact.
Right. Mm-hmm. And that's a fundamental thing. You learn that all people have the same needs, no matter what system they follow, but you're talking to them from your heart, and that's great. I really applaud that. Have you ever had a situation where there was someone who was praying, and that really helped them, or they were in a really bad way, and they get calmed down from prayer or from
absolutely
just breathing or meditating? Can you remember anything like that?
Actually, I had a situation recently where somebody was seeing me for their own illness, but after talking with them for a few more minutes, realized that there was much more going on in their lives, and their daughter was actually sick with a heart transplant rejection.
Oh. Wow.
So, I'm here sitting with this patient because she has a different illness going on personally, but seeing how her whole life is being impacted also by the, illness that her daughter is experiencing, I was able to kind of sit with her, talk, process, care for her, and even just hug her.
Mm-hmm. Mm-hmm. And I can tell you that means so much. Just to be a listening ear. That's medicine, really.
Yeah.
And right. Touch and hugging.
I think it made all the difference. And to me too, to be able to, really care for somebody helped me to process, her situation and just the kind of difficult things we see as physicians.
Exactly.